Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten from News Channel Nebraska, and I'm joined by Dr. Volkmer today. And Dr. Volkmer, I guess just to get things started off, can you tell me a little bit about what you do?
Sure. So I'm an orthopedic surgeon here at Columbus Orthopedic and Sports Medicine Clinic. My specialty is sports medicine, so I deal more with the athletes, young active population, do more minimally invasive surgeries, so arthroscopic surgeries, ACL reconstructions, that kind of stuff. I'm also the medical director of the sports medicine team that we have here in the hospital, which includes several athletic trainers, physical therapists who work full-time with the schools to provide sideline coverage, training room coverage. So I kind of work closely with the athletic trainers in that regard too.
Very cool. Well, I guess working with the high school kids and working in athletics, what's that like for you, getting to see the kids kind of grow up? Some of them you're obviously treating, but a lot of them you're just watching them play and trying to help kind of be preventative and treat minor injuries too.
Yeah, it's been really cool. I've been here about 3 years now, and so the initial group of kids when I came started as freshmen, now they're seniors graduating, which really makes time seem to go very fast. But so it's kind of fun in my role where you see some of these kids very early on in their high school careers. Maybe they have minor injuries, hopefully minor, that you can kind of help get them through. But yeah, you see their progression through high school, how they mature, how they become not only better athletes, but better students, and really turn out to be really great kids and really great people. So that's been a really fun part of my job, to be directly involved with patients and their families and see that progression over time, where maybe in other specialties we don't really see that. We don't really get that continuity of care all the time, where in sports medicine you see these kids constantly throughout their school years. So it's been a lot of fun for me.
What are some common injuries that you see as treating a lot of high school and some college kids?
The most common injuries are still things we treat non-operatively: ankle sprains, shoulder sprains, all that kind of stuff. Obviously we see a fair number of ACL injuries, and I think it seems like it's going up more and more every year, as I think a lot of that has to do with girls becoming more active in sports, whereas even when I was in high school, which wasn't that terribly long ago, we didn't have a girls soccer team in high school, and now most schools have girls soccer teams and more girls opportunities, and we see a little bit more of that in terms of ACL injuries. Obviously concussions are a real hot button topic too, and we're very fortunate in Columbus to have actually a specialized concussion clinic that's run by Dr. Robert Miller. He's a ER physician, but specially trained in concussion management. And that's been going on for the last year, I think, at least. But it's been phenomenal to get those kids in under one roof. And it's not just kids, but work comp injuries, everything like that. But it's been really impressive for me to see that service provided to Columbus. And I think it's been great from a sports medicine perspective to get these kids treated consistently and just under one roof and one protocol and get them back safe.
Well, when you look at the preventative measures, and obviously each different type of injury, you look back and you're like, well, maybe if you did this more, that could have helped prevent this, or vice versa. Is there anything in general kids can do, or even parents or older people, that can help prevent injuries that you might have to come see them for?
Sure. A lot of preventative treatment is really conditioning ahead of time, ahead of the sport that you want to be involved in. So whether that's off-season conditioning for the high school kids, where it's very important to build muscle strength, core muscle strength, lower leg strength in terms of preventing ACL injuries, or even ankle sprains, Achilles tendon ruptures. Those kind of all go in with kind of being deconditioned actually. So that's probably the most important thing, is getting a good off-season conditioning program where you're doing some weightlifting, doing some general conditioning, not just 100% sport-specific stuff even. And I think one thing that also helps too is not subspecializing in a sport very early on. So still having kids play 2 or 3 sports throughout the year I think helps. Use different body types, body muscle groups to kind of prevent overuse injuries too. And the same thing even with kind of weekend warriors. It's just before you go gung-ho into training for a marathon, you have to build up to that, obviously. So starting from a good base, doing a good conditioning program, doing some cross-training, I think really helps in preventing injuries.
Very cool. Well, can you tell me a little bit about your background educationally and your kind of journey to Columbus?
Sure. So I grew up in Auburn, Nebraska, which is a tiny one-stoplight town way in the southeast corner of the state. I did my undergrad work at Creighton, and then did my med school at UNMC in Omaha. And then we decided maybe it's time to get out and see a different part of the country. So I did my orthopedic surgery residency at Loyola in Chicago. And I decided that still wasn't quite enough schooling for me. So I did 1 extra year of sports medicine fellowship out in Los Angeles at the Curl and Jobe Orthopedic Clinic. And there I had the opportunity to work with most of the pro sports teams in the Los Angeles area, as well as USC football, a number of junior colleges and high schools. So that was a really great experience for me in terms of team coverage, game coverage, really working directly with high-level athletes, because that's always been my passion, really, is getting on the sidelines in the training room, day-to-day, working with these athletes and kind of getting out of the clinic environment, being on the sidelines and having to make quick decisions, trying to determine who's safe to go back and play and how we get them back to play. You have to kind of think outside of the box a little bit. So it's a little bit of pressure, but it's also a lot of fun for me. So that's kind of my journey to how we got here.
Very cool. Well, sports, you talk about that being kind of a passion of yours. Is that always what you wanted to do when you started studying medicine? Did you have the idea like, hey, this is exactly where I want to be when I finish schooling?
Pretty much, which was kind of unusual in terms of my other colleagues in med school. Most people go in not really having a real clear idea of what they want to be, but I actually went into med school knowing I wanted to do orthopedic sports medicine, so I was kind of really focused on that. And growing up, I was just kind of a sports nut, so I was always around sports. I had older siblings who were very involved with sports, so something I grew to love pretty quickly, and I guess I thought, it would be cool to make a job out of that. And I was also drawn to science, just natural interest in science and why things work the way they work and how can we figure things out a little bit better. So those two areas kind of came together. And probably the thing that really solidified it for me actually was an assignment during freshman English in high school. We had to write a letter to someone who was in a career field in which we thought we might be interested in. So I actually wrote a letter to George Sullivan, who was a head athletic trainer with the Nebraska football team at the time. He's kind of a legend. And kind of to my surprise, he wrote me back a very nice, detailed letter in terms of what he does on a daily basis and kind of the schooling you need to get there. And that just really, confirmed my interest in it. I thought, wow, that would be a cool area to get into. So actually, I guess I went to college thinking I was going to be an athletic trainer. That was my plan. And kind of changed a couple of years in where I thought maybe more of the surgical side of things would be where I fit in a little bit better, but still very similar in terms of where I wanted to end up. So.
Well, we touched a little bit on the minor surgeries and that kind of stuff that you do. Can you go a little bit more in depth on kind of the different things that you are?
Sure. So I do a fair number of ACL reconstructions, unfortunately, for the kids. So that's a very common procedure that we do. I do arthroscopic shoulder surgeries, which means minimally invasive through 2 or 3 small incisions. So I can do rotator cuff repairs, labral cartilage repairs in that manner. Actually, I've done some hip arthroscopy, which is a little newer technology. It's been out in the last probably 10 or 15 years where it's really kind of catching on. But same ideas in terms of knee arthroscopy or shoulder arthroscopy. It's through 2 or 3 small incisions, and we can treat cartilage tears in the hip. We can treat kind of bony abnormalities in the hip, and we're seeing more and more of that in recent years just because I think we're paying more attention to it. Before hip arthroscopy was really invented, we didn't have a good way of treating those injuries, so we kind of ignored them a little bit. Yeah. So it's not that they're new injuries, we're more appropriately treating them now, so the numbers continue to go up, and that's something we've started doing here in Columbus. So those would be kind of the more common procedures that I do, in addition to general fracture work and stuff like that comes in on call.
Well, if someone wants to come see you or come visit with you, if they might be feeling some pain or something, how do they get in touch with you?
You can always call our clinic. We're a Columbus Orthopedic and Sports Medicine Clinic. It's 402-562-4700. We're in the medical office building right attached to the hospital, so very convenient to find. And it's a great environment. We have a new clinic space. The hospital's really invested quite a bit in our clinic, which has been great from our perspective. We have a great relationship with the hospital, and it's nice to have it all kind of in one campus here. They've done a great job really building this up and having all the resources right here for patients no matter what they want. They don't have to travel very far.
Dr. Volkmer, thank you for joining me. I appreciate it.
Thank you. I appreciate the opportunity.
And thank you guys for tuning in to another edition of Meet the Doc, sponsored by the Columbus Community Hospital. I've been your host, Grant Otten. We'll see you next time.